Just a few comments. First of all, I want to echo Dan's thoughts about thanking you as a staff for your patience in understanding through what has been a pretty long journey to get to today. We clearly understand when these kind of transitions happen, there's a lot of anxiety and concern at your level, and so we appreciate your patience. We appreciate Bill and team's leadership around that, holding that together, and we hope over the coming months we get to earn that trust that you've already given us through this period through our actions. So looking forward to doing that, but thank you. Dan talked about the formation of the company and the history. Why don't we talk about a little bit, just briefly, it's kind of what we believe and how we think about healthcare in the communities we serve. And then I'll ask Mark to really talk about our vision a little bit around the partnership around the Upper Cumberland. But our culture from a corporate office is really built around kind of principles of servant leadership. We see our roles as leaders of a company to support you all in what you're doing. I really love that visual right there with Capella kind of underneath your two hospitals, kind of not on top but below, helping to hold you guys up. And so that, Dan talked about how we rate ourselves through what you guys say about us. I really do believe that's important. Our culture as a organization, though, is really built around the foundation of 5 pillars. But it's built about the 5 pillars of quality, service, people, growth, and financial performance. And the first two, you kind of look at it from right to left, quality and service really go together, quite frankly. Quality speaks to how we take care of our patients, both clinical outcomes, but also their expectations and perceptions of care. That's the quality. Service really speaks to how we interact and deal with our physician partners, whether it's a more formal partnership like it is with the medical staff here, or the other version where we just work collaboratively with our doctors. But we see our medical staffs as very important stakeholders in what we're trying to accomplish. The other aspect of service is our service to our community. We know that in partnership with our physicians, that we may own the bricks and sticks, if you will, in any of our communities, but it truly is the community's hospital, and we believe that, and we have a stewardship back to this community that we take very, very seriously. In the middle, quality service is people, and that's really talking about you and the 6,500 employees across Capella, and we intentionally put the people pillar in the middle, because we do see that as kind of the fulcrum of which, if we keep everything in balance, it's really through our employees that we take quality and service and manifest that into strategic growth and good performance, sustainable performance over the long haul. So we invest a lot of time in our people. Our student efforts is largely centered on the notion of basically empowering and developing leaders across the company. Growth is the 4th pillar. I mentioned earlier to the group up in DeKalb, today, I think Dr. Spurlock even made mention of this, we're kind of in a growth-challenged environment as hospitals across the country. Inpatient volumes across the industry is contracting. We see more and more outpatient procedures that used to be the domain of the hospital kind of migrating to other settings, whether that's physician offices or ancillary providers. And so you really need to have a focused strategy around creating growth in any market if you're going to be successful in the long haul. And I will tell you, the crux of this partnership between these 3 hospitals and throwing in River Park to create what we call the Upper Cumberland Network is really built around this notion of manufacturing strategic growth. And Mark's going to talk a little bit about that and how that really repositions us for success moving forward. And then the last pillar, of course, is financial performance. It used to be part, I always say this with the company, used to say, well, if you do the first 4, the 5th one comes naturally. And it's not our sole focus, but I would tell you, I might put a different spin on it. I might say, unless you do the first 4 really well and are committed, quality, service, people, and growth, you're going to struggle on the 5th, but it won't come naturally. You're going to have to also have some discipline around that. So that's just a little bit. You'll hear a lot about that in the coming weeks and months as we start to indoctrinate you with the Studer stuff. I think you'll really enjoy that as leaders of your hospital. I think you really feel good about that. But in closing or wrapping up, I just want to say thank you again for allowing us to be part of your family, and we welcome you into our family as well.